Are you preparing for Plab 2? Do you want to know what to expect in Plab 2? What examiners look for? How examiners mark the exam? Stick around for an analysis of Plab 2. If you're new to this channel, hi everyone, this is Dr. Erwin Kwun. My mission is to help doctors lead a happy and successful life. I publish new video every Thursday to help doctors on their journey. If you have not already subscribed to this channel, please subscribe and ring the bell so you're notified first each time I publish a new video. Imagine yourself being able to practice medicine in the UK. You can advance your career and work in the NHS. Succeeding Plab 2 is an important part of your journey before you can practice medicine in the UK. Today I will cover what you need to know to succeed in Plab 2. First thing first, pause this video and write down in the comment section, where did you complete your medical degree? Or if you're a medical student, where are you studying? Plab 2 is an objective, structured clinical examination, also known as OSCE. OSCE is a practical clinical exam. It consists of 18 scenarios, each lasting 8 minutes. It is a mock consultation with simulated patients. A simulated patient is a trained actor who is briefed to role-play a scenario. Think of it as you have a clinic with 18 consultations. You will have at least 2 rest stations allowing you to take a break. The exam covers everything a UK trained doctor might expect to see on the first day of Foundation Year 2. Plab 2 can only be taken in the UK. The exam is held in Manchester. To apply for Plab 2, you need to have passed Plab 1. The duration of Plab 2 is around 3 hours and 10 minutes. You have 1.5 minutes between scenarios to read the instruction and patient information. You have 8 minutes to complete the task. At 6 minutes, a bell will ring to inform you you have only 2 minutes left. Plab 2 is a test of your professionalism, your ability to apply knowledge to the care of patients. It is not a test to remember and recite facts. You have already been assessed on your knowledge in Plab 1. Each station in Plab 2 is worth 12 marks, except for the rest stations. What do examiners look for? Let's go through each of the 3 domains. You can obtain 4 marks for data gathering, 4 marks for management, and 4 marks for interpersonal skills. The first domain is data gathering, technical and assessment skills. In this domain, examiners are looking at your ability to take a focused history, perform a physical examination, and practice procedures. They also assess how you interpret investigations that leads to a diagnosis. The second domain is clinical management skills. In this domain, examiners are looking at your ability to formulate a diagnosis, explain something to a patient, and formulate a management plan. The third domain is the most important domain, interpersonal skills. This domain is important because you can be scored on this from the moment you step in a station up until the end. As an IMG doctor, your approach to the consultation might be different in the countries where you were trained. Examiners are looking at how you approach the consultation, whether you establish rapport with the patient, how you use open and closed questioning, and how you're involving the patient and showing your professionalism and an understanding of ethical principle. Many candidates struggle to score high in interpersonal skills because of the difference in the culture and the way things work in the UK. The approach to consultation is preferably patient-centered. It's important that you have a grasp of the UK system. What stations can you expect in Plab 2? In Plab 2, we can divide the station into 3 categories. The first category is medical ethics stations. Second category is history, examination, diagnosis, and management station. And the third category is examination stations. Let's take a look at medical ethics stations. Following recent changes to Plab 2 examination, approximately 11 of the 18 stations will have an ethical element. GMC Good Medical practice highlights patients must be able to trust doctors with their lives and health. To justify that trust, you must show respect for human life. In medical ethics stations, you need to demonstrate you abide by the professional codes of the GMC. Make sure you read Good Medical Practice. Here are some salient points of Good Medical Practice. Make the care of a patient your first concern. Protect and promote the health of patients and the public. Provide a good standard of practice and care. Treat patients as individuals and respect their dignity. Take prompt action if you think that patient safety, dignity, or comfort is being compromised. Work in partnership with patients. Be honest, open, and act with integrity. Medical ethics scenarios are based on a wide range of issues, from confidentiality, domestic violence, do not attempt resuscitation orders, to child safeguarding. For example, you are the FY2 doctor in a GP surgery. Your next patient is a 15-year-old girl who wants to start contraception pill. Your task is to take a history and discuss the management with the patient. In this scenario, there is an ethical dilemma because the patient is only 15 years old and wants to go on the contraception pill. As the FY2 doctor, will you prescribe the contraception pill to that patient? In this scenario, it's important to gather more data from the patient to understand the reason around why she wants to go on the contraception pill and to know whether she's in a stable relationship, how old is her partner, whether the parents are aware, whether the patient does not want to let the parents know, and to know whether the patient has capacity and whether there's any safeguarding issue. A useful resource to deal with such scenario is a Fraser's Guidelines. Communication skill is key. Please remember, communication is a two-way process. Candidates who are not accustomed to listening what the patient has to say often make the mistake of just giving a lecture to the patient. Doctor-centered consultation does not tend to go well in medical ethics station. We need to involve the patient in the consultation. For example, a patient undergoing a gastroscopy might be more interested in knowing whether they will be put to sleep rather than all the details about the procedure. If you don't find out about the patient's concern, you won't be able to address their issues. This is why it's important to let the simulated patient speak and listen attentively. They will give you the relevant information without having to work hard for it. You will find the consultation goes smoothly if you listen to the patient. The next category is history, examination, diagnosis, and management stations. These stations consist of seeing a patient in a typical clinical setting. You need to elicit a history, perform relevant examination, and discuss your management with the patient. The scenarios include various specialties such as medicine, pediatrics, and psychiatry. You need to ask relevant questions to elicit a focused history. For example, assessment of suicidal risk and social history are crucial elements in a psychiatric scenario. In a pediatric scenario, questions related to baby feeds, the waterworks, activities, immunization history, birth history, and the health of siblings are important. Candidates often spend too much time in data gathering and neglect clinical management domain. Once you have elicited a focused history and examined the patient, the maximum score you can obtain is 4. You need to move to the second part of the consultation. Remember the 4 marks for clinical management you need to obtain. A common mistake is to rush to clinical management when the bell rings at 6 minutes. How can you expect to cover clinical management in 2 minutes? Candidates who do not give themselves sufficient time for clinical management risk failing the station. To obtain 4 marks in clinical management, you need to show that you have formulated a diagnosis, explain your management plan to the patient, safety net, and arrange a follow-up if necessary. Timekeeping is key in these stations. An efficient use of time is to aim to complete data gathering in approximately 4.5 minutes, so you have at least 3.5 minutes for clinical management. You won't have a clock in the station, so you need to be able to estimate where you are in the consultation. When you practice, make sure that you have a good estimate of the time that you're using in data gathering and clinical management. The third domain is examination station. These stations are straightforward if you have practiced examinations on mannequin and have polished your skills at procedures. Make sure you have a structure when you approach an examination. Stations include eye examination with ophthalmoscope, breast examination, vaginal speculum and bimanual examination, cervical smear procedure, testis examination, Procedures you need to prepare for include arterial blood gas, venous cannula puncture, CPR for adults and children. You might have some acute scenarios where you have a sim man. Remember to use an ABCD approach in emergency situation. Other procedures you need to prepare for are wound suturing, male and female urethral catheterization. Read the instructions carefully outside the station. Sometimes you might be instructed, patient has already given consent, so you can start performing the procedure straight away. It's vital you follow safety precautions such as discarding sharps in the sharp bin and cleaning with antiseptic solutions. What are the criteria to succeed Plab 2? There are two criteria. The first criteria is the overall score you obtain. You need to obtain an overall score equal or above the pass mark. The pass mark varies according to the difficulty of the exam and how well the other candidates have done. Generally, the pass mark is around 115 to 130 out of 260. The second criteria is the number of stations you pass. You need to have passed at least 11 out of 18 stations. It's important to highlight that even if you're failing some stations, make sure that you're still obtaining as high marks as you can in these stations. Because if you're failing stations with very low marks, it's going to drag your overall score lower. There you go. This was an analysis of Plab 2. If you want more videos like this, smash the like button. If you have not already subscribed, don't forget to subscribe and ring the bell so that you're notified first each time I release more great tips just like these. If you found this video useful and want to improve your interpersonal skills, go and watch my interpersonal skill video. If you want to learn more about patient-centered approach, watch the video where I cover ideas, concern, and expectation. Thank you so much for watching. Take care everybody. See you in the next video.